Okay, good morning. Looks like we are live. This is Facebook Live number 23. It is May 27th, 2024, Memorial Day here in the US. So if you are off today, I hope you're enjoying a nice day off. And if you're working, I see you. I'm working as well today. So today we are going to be talking about supplements for sleep and just kind of, we're not going to go into specific details about supplements. I actually have an upcoming masterclass on that, which I'll share. But we're just going to talk about how doctors can think about using supplements for sleep and for other indications. And I think this is such an important topic because our patients are taking supplements and we as physicians don't really get much training in them and how to use them, how to dose them, and all the different considerations that go into supplements. So I'm just going to share some thoughts, how I think about supplements, dietary supplements, and I'd love to get your thoughts on this topic as well. So you can let me know in the comments where you're joining from, what your background is, if you're a physician, a therapist, and other type of healthcare practitioner, if you use supplements for sleep or for other indications in your practice, and any challenges that you see with regard to this topic or just managing sleep issues, please let me know in the comments. I'd love to hear from you. If we haven't met, I'm Dr. Nishi Bhopal. I'm a physician. I specialize in integrative psychiatry and sleep medicine. And I have an online program for physicians and therapists to learn more about sleep because most of us don't get much training in it. So yeah, I thought I'd talk about this because pretty much all of my patients are taking some form of supplement, whether it's, a vitamin, a mineral, an herb, botanical. Sometimes I recommend it to them, but oftentimes people find them on their own. They see them on Instagram or they, find them at Target or, they buy something on Amazon that their friend told them about and whatnot. So a lot of patients are taking these supplements. And as I was saying, for us as the physician, we really don't get much training in them. So I've had patients ask me, what do you think about this supplement or that supplement? And now with the training that I've done, I have a lot more understanding of them and, have a lot more education around different types of supplements. But when I was first starting out after my residency, I didn't really learn about them. So I was like, kind of trying to figure it out when patients would ask me questions. I didn't really know a lot of the time. There was a study in 2023 from the Council for Responsible Nutrition. They did a consumer survey, and in their survey, they found that 74% of US adults take dietary supplements, and 55% of them take them regularly, right? So that's more than half, and then like 3/4 of adults are taking some type of supplement at some point. And why this is important is because just because something is natural or over the counter doesn't mean that it's safe. There can be drug interactions, there can be contraindications. For example, I've seen patients with, new onset of weird symptoms. So I'm thinking about some patients I've seen who are prescribed SSRIs. They start taking a supplement and now they feel really activated and it almost looks hypomanic, or it looks like a flare up of anxiety. And then we look at their supplements and it turned out they were on a supplement that interacted with their medication and was causing those symptoms. Then we removed that supplement and their symptoms resolved. So an example of this is rhodiola, which is an adaptogen that is found commonly in different herbal blends. And that can sometimes cause a little bit of activation in patients on SSRIs. So just an example of, why it's important that we as physicians understand these things and not just write it off and go, yeah, I don't know, there's no data behind them, there's no evidence, you shouldn't be taking that, because there is a role for them as well. The AMA, American Medical Association, in 2020 actually came out with a policy saying that doctors should be asking patients about supplements because so many of them are taking these different compounds. And so we need to be asking about them. We need to be documenting it in the chart. We need to be educating ourselves on it. And this is something that I do in my clinical sleep kit program. We talk about supplements and the different indications and so forth. So I'm curious to know, if you're a healthcare practitioner, did you get any training in supplements? And if so, how much training did you get in them? For me, when I was doing my residency, I don't recall getting much training at all, except for if we were using them to treat a deficiency. So if we're using vitamin D, for example, to treat a vitamin D deficiency. But aside from that, didn't really get much training in the use of herbs and botanicals and other things like this. And then when it comes to sleep in my sleep medicine fellowship, we learned a little bit about using melatonin and the indications for that and how to use it effectively for circadian regulation and stuff like that. But aside from that, we didn't get a lot of training in the use of supplements which is kind of ironic because if you look at the supplement market, so many of them are for sleep, or they're marketed, for sleep indications. And so, like, there's all these different powders and tinctures and capsules and tablets and all kinds of things, different blends, melatonin based ones, non melatonin ones. There's so many of them on the market, and patients are taking them and they're looking them up, or they're, finding them online and they're taking them, and they might not even be telling you. And I've even seen comments on social media, like I've posted videos about different supplements, and comments will say things like, well, doctors don't know anything about supplements. Like, why should I even ask my doctor about them? This is the perception that the public has, and it's not the doctor's fault. It's because we really don't get trained in these things. So it is really incumbent on us to educate ourselves on this topic. So I think it's time to change that, and let's change that perception, because we have so much knowledge, and we have we're able to put pieces together with the comprehensive training that we have as physicians. We can see things, we know what we don't know, right? So we're really well positioned to be a guiding light for patients when it comes to using supplements safely, effectively, to guiding them on the appropriate products, and so on. So I think that's really important. And just a couple of tips that I have for you as the health practitioner, as the physician, is just start asking your patients about supplements, what they're taking. You can start documenting it in the chart. So underneath the meds list, I also have a supplement list, and so I just document those in the patient's chart. If you are recommending a supplement to them, talk to your patient about the game plan. What's the end date on that supplement? And, are you going to be tracking labs? So for example, if you're repleting vitamin D or something like this, are you going to be tracking labs, and what's the plan there? Just so the patient doesn't end up on, 20 different supplements. And I see this a lot, where they might be working with a few different practitioners. Maybe they're working with an acupuncturist, and then they're working with their psychiatrist, and they're working with, their GI doc or whatever. And then they end up on all these different supplements, and they might just stay on them for years and years on end, because there was never a conversation around, how long you're supposed to stay on these. So really have a clear game plan with your patients. And then 3 categories that I think about when it comes to supplements is, are we using them for prevention? So an example here is using folic acid during pregnancy, right? So is it for preventive purposes? Are we using them for repletion? So are we repleting an iron deficiency, or B12 deficiency, or D deficiency? Or are we using it as a therapeutic? So are we using it to, calm the nervous system? So for example, something like L-theanine, which is one that I use a lot, or, one of the adaptogens that I was talking about. So those are the 3 big categories that I like to just have in my mind when we're using supplements, or even if patients are taking them. We'll go through their list if they were recommended by somebody else, or they just started taking it on their own. We'll go through these categories, and okay, are you taking this prevention, repletion, or therapeutic? Like, how are you using these things? So hopefully that was a helpful, just, quick little discussion on how we can think about supplements as physicians and healthcare practitioners. If you'd like to take a deeper dive into specific sleep supplements, I have an upcoming masterclass starting next week. It's on 5 sleep supplements to know about in your clinical practice. These are common supplements that patients are taking for sleep. So we're going to go into the evidence, the indications, contraindications, dosing, and other resources to know about. And I'll also be sharing more about my clinical sleep kit program, where we just have such a fun community of doctors, and we have trainings and case conference and live calls and self-guided materials, protocols, and handouts for you to use in your clinical practice, because like I was saying, most of us don't get enough training in sleep medicine unless you go and do fellowship. Even then, a fellowship isn't enough. So I've created this resource, which is what I wanted after I started working on my own after training. And so we've got an amazing program. So I'll tell you more about the program during the sleep supplements workshop. Whether or not you're interested in the clinical sleep kit program, come to the sleep supplements workshop, because you'll learn a lot. It's interactive, it's fun. Even if you came to it before, come again, because you might pick up on things that you didn't pick up on the first time. I always like to rewatch things again, even if I've been to them before, because inevitably I'll learn something or hear something that I didn't catch the first time around. So I'd love to see you there. I'll put the link to the supplements masterclass in the comments below, so come and join me. There's 3 sessions to choose from next week, so I'd love to see you there. And then any thoughts that you have about supplements, please let me know in the comments, and I will say bye for now.